We are back with more What's Now, shifting our focus to your heart, specifically Heart Healthy Month. I recently spoke with Dr. Baum all about what you can do to keep your heart healthy, specifically lowering your cholesterol. Let's take a look.
Our heart is one of the most important organs in our bodies. For the approximately 30 million Americans that have the most common type of heart disease, taking care of their heart health, including their high cholesterol, is top of mind. However, many of these people struggle to lower their bad cholesterol and keep it low. Here now with tips on how to lower bad cholesterol and build heart-healthy habits that last beyond Heart Month is Dr. Seth J, Baum, cardiologist and Chief Medical Officer of Excel Medical Clinical Trials. Thanks so much for being here today. How are you?
I'm doing well. How are you?
Doing well as well, and I'm looking forward to speaking more about Heart Month because it shines a spotlight on the importance of heart health. What advice can you share to help people improve their heart health?
So Heart Month is a great opportunity for all of us because it's a month, February, where we have a focus on our hearts. And heart disease is the number one killer in the United States, has been for decades, and it looks like it's going to continue to be that for some time to come, unfortunately. So we have an opportunity now to focus on our hearts, to be proactive, to be our own best advocates, to see our doctors, to evaluate our own health, our own hearts, our own cholesterol, see what we need to do as individuals to improve our hearts and our heart health.
What is the most common type of heart disease and its connection to bad cholesterol?
So the most common type of heart disease is something called atherosclerotic cardiovascular disease. And that's where we have plaque in the arteries that feed our heart and our brain. Now, when you have plaque in an artery, problems can occur. And in this case, it's heart attack and stroke. So these can be devastating complications. It turns out that LDL cholesterol, which is dubbed the bad cholesterol, causes plaque, causes atherosclerotic cardiovascular disease. There is that tight connection and it's causal. So it also turns out that many tens of millions of Americans have elevated LDL cholesterol and tens of millions of Americans have atherosclerotic cardiovascular disease. And we just need to do a heck of a lot more to improve this situation and to decrease LDL cholesterol and decrease the burden of atherosclerotic cardiovascular disease.
If someone does have high cholesterol, what are some of the first things that they should do to help lower it and hopefully keep it low?
So the foundation of lowering cholesterol always is therapeutic lifestyle changes. What that means is diet, exercise, maintaining an optimal weight. These are critical, fundamental aspects of cardiovascular disease prevention. But in my practice of preventive cardiology and clinical lipidology, I spend a good deal of time risk stratifying patients. And what that means is determining who's at the highest risk, who's at lower risk, and paying most attention, and not ignoring the lower risk ones, but most attention on the very highest risk patients. These are patients who have established atherosclerotic cardiovascular disease, who might have had a heart attack or a stroke or have a heart scan that shows a significant plaque burden. And what we do with these patients on top of diet and exercise is we add statin therapy. Statins are drugs that have been around for decades. They're safe, they're effective, they're the start point. The problem is that when we look at the numbers, up to 80% of these people who have established atherosclerotic cardiovascular disease and who are on statin therapy have LDL cholesterol levels that simply remain much too high. They're inadequately controlled. And we need to, for these people, we need to find alternative solutions, additional solutions on top of the statin regimen.
What new treatment option did the FDA recently approve that may help certain people lower and maintain their cholesterol?
Yeah, I'm very excited to be here to talk about that. And I'm very excited to be partnering with Novartis to help raise awareness about atherosclerotic cardiovascular disease and LDL reduction, especially in light of what's just gone on. So recently, FDA approved a novel therapeutic called Leqvio. Leqvio works by a different mechanism of action to lower LDL cholesterol. It's given via injection every 6 months at the doctor's office. And this takes place after an initial injection and then 1 to 3 months. So think about it. We now have a medicine that's given at the doctor's office twice a year which is pretty much when patients go to see their doctors twice a year. That's the time frame. So it's convenient for the patients. It helps with adherence because we know the patient's getting the medicine. It gives us a sense of comfort, both doctor and patient, a sense of comfort that cholesterol is going to be maintained because we know from the studies that LDL cholesterol is reduced in a sustained and consistent fashion. And we have it in some studies showing 52% reductions going out 17 months of follow-up in these studies. And so this gives us a great deal of assurance. Now, there are common side effects that can occur with medications. Here it would be injection site reactions, and that would be something that you would talk to your doctor about. But this is really a big and important time in lipid-lowering management, and we're very excited with the advent of this new therapeutic.
It is exciting. Where can we go for more information about this new treatment option?
Yeah, I would suggest everybody go to leqvio.com. That's leqvio.com, and really look through the website, understand everything you can. I'd also like to bring it back to ownership and the fact that patients, we need to own our own health. We need to be our own best advocates and be proactive. We need to engage with our physicians. That physician-patient relationship is paramount. And I would really suggest everybody avail themselves of Heart Month, February Heart Month, and look at their hearts and get as heart healthy as possible. And thank you very much for giving me an opportunity to speak with you today.
And thank you so much for joining us. Really appreciate your time and this great discussion about high cholesterol and Heart Month. We appreciate it.
Thank you.